the really important data that's now emerging is that epigenetic drugs may have a capacity to modulate the immune system post-transplant. There's good evidence that by demethylating the FOXP3 promoter, which is hypermethylated, and increasing levels of FOXP3, which is a transcription factor driving T regulatory cell reconstitution, you may be able to accelerate Treg reconstitution post-allograft and thereby potentially suppressing graft versus host disease, and at the same time, by upregulating tumor antigens such as MAGE-A1, you plausibly increase the target for donor CD8 T cells to recognize. And we've got nice data from a recently completed clinical trial called RICAZA that was run through the NCRN AML Working Party, where we showed in about 40 patients that post-transplant azacidine was well tolerated. It was associated with a low risk of chronic extensive GVHD. And interestingly, in the patients who developed a CD8 T cell response to tumor antigen, the relapse risk was lower. It was a relatively small patient population. It proved that this is a strategy that's deliverable, and so I think what's required now is a randomized study to look at that. And we're hoping in the next iteration of Figaro that we might be able to ask such a question.